Hey everyone, my name is Danny. I am the person in this video doing the assessment, and today I'm just going to be talking a little bit about our movement assessment. The movement assessment is an important part of our client success. This is where we get to find mobility limits and muscular imbalances. On top of that, we also get to figure out if certain movements are causing pain. Anything we learn from you during this assessment will be used to create a personalized plan to get you back to feeling and looking your best. First one is going to be the squat assessment. This will help us reveal mobility limitation in the hips and calves. We also use this to pinpoint muscular imbalances in the glutes, adductors, and hip flexors. We always go over the results with our clients right after, just so they can get a better idea where they're at and what they need to improve on. Next, we're testing overhead mobility. This is often limited in individuals who are spending most of their day sitting. During our assessments, we make sure to document all the movements so that we can track them and then go back to see progress. Another common issue we see in our clients is limited ankle mobility, so we make sure that we test that by itself. Next, we test for thoracic mobility, or mobility of your mid-back. This is very important to support overhead movements such as throwing or any kind of lifting that goes overhead. Another common issue we see with sedentary individuals has to do with muscle coordination. In other words, your body being able to fire the right muscles when they are needed. This test specifically goes over your glute muscular coordination and checks to make sure that they are firing as you lift your body off of the ground. For our next exercise, this is also going to be a coordination exercise, but you're going to be needing your entire body to work together to complete the movement, which requires a lot of stability and balance. And then not all the time, but sometimes if they're struggling with that first one, we introduce them to this one, which also is another coordination that works your core and your balance. To conclude our movement assessment, we're going to jump up on the table, and then we're going to be looking at hamstring flexibility. And we're also going to test the sciatic nerve to see if there's any disturbances there. We're also looking at your hip external rotation and internal rotation. And then we use the Faber test to see if there's any asymmetry between your right and left side and to see if anything triggers pain. We want to look at the front side of the legs too, just to see if anything's triggering pain and to see if we're tight or stiff anywhere. As you can see here, his leg is not at a 90 degree, it's sticking out quite a bit, which means that his rectus femoris or his quad muscles are tight. This more or less concludes our movement assessment, although it is different from person to person. Some might bring up issues that they're experiencing with their mobility doing certain movements or pain they're experiencing doing certain movements, and we will test for those as well. Thanks for watching, guys.